हेलो। आवाज आ
Good afternoon, everyone. Myself, Dr. Divyata Detha, first year resident, Department of Physiology, Government Medical College, Bhavnagar. I would like to welcome you all for today's session on BCBR revision. So, for the first lecture, I would like to welcome Dr. Nandini Desai, ma'am, Dean, MP Shah Government Medical College, Jamnagar, for guiding us on the topic of conducting clinical trial. Please welcome, ma'am.
Good afternoon, everyone. Uh, I think in since last few days, we are in the uh, channel of various types of research, etc. And the title which I am going to display, that is a very interesting component of the research, uh, though very attractive, very important, and very interesting part of the research component. But since few rules and regulations or the deviation from the rules and regulations relevant to this research component, some anxiety, some fear, or some risk is always there before starting this research component, and because of that we are little bit lag behind, or we are getting catch at some another non-ethical component of the research part, because of the inadequate knowledge, or you can say inadequate efficiency, or you can say because of the inadequate support for the clinical trials. And that's where clinical trial or the conducting the clinical trial is always an component who has been ignored or who's not been established properly in various institutes or in the various scenarios. And but in the last few years now, the conducts rules and regulations are going to has been established. Some monitoring agencies have been activated, and under their protection now the clinical trials can be the very much attractive part of the next few years. Uh, Scenario of the clinical trial in India, which I already explained, is restricted due to certain issues, but still uh, BCBR training will definitely enforce this to us uh, to enter in the clinical trials also. As they says, in first decade of the 21st century, it was rapidly expanded, but has faced some challenges due to regulations reformed in the 2012-13. India has introduced the regulations very firmly from the 2019, and it has been under conduct of CDSCO, and so now it is easier for us, those who are working genuinely on the clinical trials. The main challenges which have been perceived by international investigators and sponsors include delayed approval because the process is lengthy, quality of the ethical review. Again, sometimes it is biased, sometimes it has been challenged because of the inadequate knowledge of the ethical agencies, or sometimes some malafide intentions. And shipment of samples, import and exports will sometimes very much difficult, and I do not need to explain much more about this point number 3. Overall deficiency of duly trained investigators and centers. This is basically, when from where I am coming, I accept, I confess that this is the biggest component which is restricting for the clinical trials, and close of the compensation even for the clinical trial participants. It's a challenge, and some reformations are going on to clear out this confusions and misunderstanding. And recent requirement of the audiovisual वो अब नहीं रहा है. We are having, well, we are well equipped, we are having so many supports and tools which helps us for the to cover up this hurdle. uh, As we know, the clinical trials has been uh, uh, mm, classified from phase 1 to phase 4. It all depends up to the at which level we are restricted. Small and safety checks can be considered as a clinical trial phase 1. 2 is a component which is in between 2, 1 and 3. That is a 3 is a large scale efficiency confirmations, and that is the phase 3. And then fourth is the long term application of this trial and their feedback and output. So one is little bit easy, two is it can be the extension of the one, three we can go for the confirmatory trials of the one only, and fourth is implementation for the long period and with its feedback and reversal. The the regulatory mechanism, this is very very important. So far your MCQs are also concerned and your knowledge is concerned, and this is an excellent table which if we can understand and if you can apply, the clinical trials are not at all the difficult component of the research part. The scientific, ethical and regulatory reviews must before we introduce for our clinical trials, and this is the concerned implementation of the research protocol are 1, 2, 3. Is the research question sound? That will be reviewed by the scientific committee, institutional scientific advisory committee, or the Indian Council of the Medical Research. Now, is the safety and the welfare of the research participant is adequately protected or not? This is an ethical review and which will be done by the institutional ethical committee. So there must be two establishment at your institutional level, one that is the institutional scientific advisory committee, and second that is the institutional ethical committee. The job chart, the purview of these two committees are totally different, and they are making our protocol to pass on very easily. The first step is a review by the scientific committee. Once they will agree with our research question, then it enters into the ethical review. When the institutional ethical committee will pass on our question, then are the research methods appropriate or not? That should be regulated by the health ministry screening committee or drug control journal of India or genetic engineering approval committee. So from if our trial subject is passing through these three committees, then it is not difficult to further proceed for the trial ethical clinical trial research committee. Now after passing or during the passing of these three committees, there are few issues which we are facing, especially ethical issues in the clinical trial. They are, is there a mechanism for the independent ethical review, approval from the ethical committee and in the country regulatory authority? Which mechanism exists to ensure protection of human subject throughout trial preparation? These are the questions which we have to front during our ethical passing. Is there adequate community engagement or support? This is again an important component. Then informed consent, very 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 important component of the clinical trial. Not even in the clinical trial, the informed consent should be the part of the medical science. As and when you are facing fronting the patient or society or patient's relatives, whether it can be the diagnostic component, whether it can be the therapeutic component, or whether it can be the research component, when you are collecting the data, scrutinizing that and displaying in the form of the research, the consent may or may not be required. Even it can also be challenged anywhere, but informed consent is must in any, it's an huge subject, and I think one of the our faculty will have narrated the importance of that. But here I say that in any form informed consent is must before starting any trial. Then standard or care and post-trial support, these are the ethical issues which has been evaluated by the ethical committee, and it should be approved from them before we start. And use of the placebo, and confidentialities. I don't think that require much discussion about last 2 points. Now, critical issues in trial implementation. 1. Informed consent procedure, as I told, it is must. Without that, we cannot move further at all. If any person is not agree, sometimes it happens that in initially phase, if your counseling is proper, if they are having adequate attraction, if they are having a short-term goal, if they are finding some interesting in your trial, they agree also. But there are possibilities that in future, if they are not getting satisfied by your performance on any aspect of which I have narrated, they can challenge your trial. So this is a very important thing. So in that consent, written, verbal, oral, by video, by audio, whatever way, the patient, the person who is coming as a sample in your trial should be satisfied. Screening and enrollment, strict adherence to the inclusion exclusion criteria. We all are learned people. The audience which is there in front of me, they have gone through 1 or 2 research conditions. So the inclusion and exclusion criteria, importance of inclusion and exclusion criteria, we know very well. Good clinical and laboratory practices, GCP, GLP are must, and we know the importance of it since long. Quality control and assurance. Quality control and assurance are also very much important component of the clinical trial implementation. Adherence to the intervention and follow-up and multi-centric trial if we are going to do standardization of the study protocol. When we are performing multi-centric trials, standardization of the study protocol is must. And study protocols, usually formats are available, and we need to follow that very strictly and absolutely within the area of safety. Now, the critical issues in the trial implementation 2. Independent monitoring, then safety assessment, reporting and management of the adverse and serious adverse events. Those who are performing clinical trials and they're in the audience, they must be knowing how much issues they are facing during these trials, and reporting and management of the adverse and serious adverse events, clinical, laboratory, social, and familial, is must, and it is required. So these critical issues should be addressed when you are in the implementation 2. Then third component, again very important, which I have informed in relation of the informed consent. And here I am informing in the form of reimbursement, compensation, and grievance redressal. Lots of documents are available, lots of references are available, but there must be a institutional or the state level or national level guideline, which should we have to be adherent to that guideline before entering in the trial. So far, monetary component is concerned. Monetary component is very much important. All of us know, ₹1 ₹2 નો ફરક પણ ઘણી વખત issues create કરી શકતો હોય છે. So you must be very transparent when the issue of the reimbursement is there, when there is an issue of the compensation is there, and when there is a grievance, you have to be having a perfect mechanism for the redressal of such grievances. And you should follow the trial stoppage rules in any type. We had, I will definitely utilize this platform to share one incident. Since 2011, we had one a very bad, the worst, I think, experience of the clinical trial at various aspects. Those who have conducted the trials, they are suffering. Those, the trial on whom this the trial which has been done, they have also suffered. And because of this performers and performances, the system is also suffering since 2011. So very sensitive component of the research, and it should never be any component of this guideline should not be ignored. Then documentation archival. Implementation of implement in clinical trial. These are the impediments in clinical trial participation. At the level of the patient, don't know about the clinical trial, समझावू पड़े, समझाना पड़ेगा. We have to explain. They should be able to digest our purpose, and they should know their benefits and their losses. Don't have access to clinical trials. This is again thing which we have to explain to them on the verbal cases, on the trial basis, on the written basis, on the video or audio. May be afraid of suspicious of research. One more very sensitive component. If someone asks me to be a sample of the such trial of in such trials, I will definitely refuse. No, I am not interested in those. At that time, your role is extended and you have to explain everything very clearly regarding their benefits, regarding the benefits of society, regarding the losses, and regarding the achievements. They can't afford to participate. One very important component, time nathi, samay nathi, capacity nathi, whatever it can be. They may not want to go against healthcare providers' wishes. This is a very tricky situation, and that should be dealt before we enter in the trial. Now, the impediments in clinical trial participation at the level of healthcare providers like us. Lack awareness of appropriate clinical trials like me. I do not know because I had a worst experience as a part of that trial, and now I don't want to know even. So this hurdle, this obstacle, this bottleneck area should be clearly opened up by various counselings and by various explanations. Be unwilling to lose control of a person's care. This is also one of the very important component usually seen. Those who are not much daring, they have restricted their capacity and their performances up to the therapeutic aspect or diagnostic aspect only, and believe that standard therapy is best. And this is a long-term rigid learning, unlearning, and relearning. If this cycle we can establish in a person, then and then we can get a good response from these healthcare providers. And be concerned that clinical trial add administrative burdens. This is not only the burdens, it can be hurdle also, it can be the obstacle also, and it can challenge your safety also. So in that scenario also, the open discussions are required to convince the healthcare providers also. So this is the trial participation is again it requires lots of efforts of the those who are going in the trials also. They have to convince either parties as well as, and in that case lots of researches, lots of support systems are also there. The institute can strengthen their committees to guide such type of people, and a culture of trials should be established from the junior most people, so when they enter in the seniority they attempt to go for such type of the trial participation. So this is a little overview about the title, and that is the conducting clinical trials. Thank you everyone. Any question, any scope of question answer, or should I close? Madam, should I close?
Yes, ma'am. I think we don't have any questions in the chat box.
So can I stop? Okay.
Sure, ma'am.
Thank you.
Thank you very much, ma'am, for your valuable insights. Now I would like to welcome Dr. Atul Trivedi sir, Associate Professor, PSM Department, BJ Medical College, Ahmedabad, to shed some light on the topic of preparing a concept paper for research project. Please welcome, sir.
Thank you, madam, and Nandini, madam, for establishing a context. I am little bit out, so I will stop my video because of the limited connectivity. Please share the presentation. So my the topic which is given to me is regarding the preparation of the concept paper. So by and large, this concept paper means whenever you are come across with some idea and you want to do research, you want to do some establish some facts, you want to establish some evidences. At that time, this kind of work is necessary. It's a very much it gives you the idea, your idea to be put on the paper a little bit with uh, proper their guideline, so that you can submit it and you can apply for the grant. And many research agencies, these grant agencies, they also demand this concept paper. So concept paper basically prepare. Next, please. Next. Yeah, please. Okay. So concept paper is a issue. You see that it is a when we start our journey, there are 7 steps, as you know, regarding the identity of the topic, question, and objectives. Outline one-page concept paper. So when you start with your topic, you are start with your objectives. The next step, very more important step, is outline a one-page concept paper. So it's a see the name suggests it's a one page. It may be more than one page, but it's a concise, precise. One your what a gap you have find out and what kind of the research you want to do, that you put on the paper and convey to the evaluator that okay, these are the issues which I want to do my thesis or my work. Okay, next please. Okay, this is the life cycle of the research, as you know, beginning from the data needs, then the spell out the research question, and formulate the study objective, plan the analysis, prepare the data collection instrument, collect data, analyze data, draw conclusion, formulate recommendation, and inform the stakeholder regarding your findings. Next, please. Okay, next, please. Go ahead. Next, please. Okay, please. Okay, that fine. So this is how you can. It is a necessary, as I told you, that concise, small write up which depict that what you want to do, and you convey to the faculty, guide, reviewer, funding agency, and everybody is running with the short of time. So with a small presentation, you convey your idea to the person who are going to be your evaluator or who are going to be your reviewer. So they may give some input that you have to change so and so, and finally you submit your to the funding agencies. Many concept papers are not developed because the idea is not born. It's maybe abort. So it should be a habit. So whenever you desire, you want, and you are planned thoroughly that I want to work over this issue, then start right up. So when you put the things on the paper, then you are more your idea would be more get clarity, and also you start work over it. Okay, so that's why always make a habit of preparing a small concept note. Next, please. Fine. So how to write this concept note? It's a simple one-page bullet style paper in which it contains background and justification. It contains the objectives. It contains the methods, expected benefits, key references, and budgets. Let us see one by one these 6 elements of the concept paper. Next, please. Okay. So background and justification. Whenever you start your journey, of course, you have gone through some literature. You have come across with the issues. So you must have learned. You must search some literature from the net. Now, from that, whatever the idea you got, you start justifying the problem. This is an important problem. It's a public health problems. This problem required some insight. It draw the attention of the policymakers or the administrator to do something over this issue. So importance of the problem, why this problem which is you are undertaken is important. Then you write down that what the known and what are the unknown about this problem. So known things which you have collected from the literature, and the things which is unknown. That means that is a still gap is lies is existing. So you can you write down so that it justify your problem. That why it is necessary to undertake this research on this problem. And of course, the information that is lacking, that is missing to address the problem effectively. So with that background and justification, you start up your you explaining your research project. So, but it see these are in the bullet form. It's a small point, which is not in elaborately written, but it convey the message to whosoever is reading this that this problem is important. Its justification is there, and they convinced that okay, this problem should be undertaken as a research. Please next, please. Thereafter, the objective. Yes, you have already clear with your objective. Without objective, no research paper can be research undertaken. Objectives are there some written element where you write down that what are the objectives, what by this research project, what are you going, which problem is going to address. So that part you mention here. So it can be general, but be specific about it, and you can divide into the primary and secondary. Next, please. Thereafter, the very important part came. Very, very important. Here you are mentioning the methods, by which method you are undertaking this research. Depend on the study design which you are going to take. Your methods will depend on it. Suppose you are taking the cross-sectional method, or you are taking the cross-sectional design, you are taking the cohort or in an analytical. So whatever the study design you undertake, according to you have to write down the method. In the method, again, you can subdivide into the various bullet point, and each bullet point you have to mention something. By looking at this slide, and this method part, the researcher mention, and the reviewer or the evaluator would understood that exactly what kind of the things you done to fulfill the objective of your research. So here, as you know, the study design, which I mentioned, which kind of the study design you are going to take, study population, under which study population you are going to, you are doing your study, various operational definitions that are very important things. This definition you should mention with the standard in one, which is which by which way you can convey that okay, these are the things, these are the definition. According to this, we are going to do we standardize our research activities. Thereafter, the sampling procedures. Sampling procedures are very much important, because here the what depend on the study population you justify that so and so by sample size calculation you understood that okay, these are the samples, my sample size, and according to this I will select the study population, and within this is sampling frame, whether it's a consecutive sampling, whether it's a purposive sampling, whether it's a quota sampling, whether it's a probability sampling. So based on this various sampling method, you justify that okay, you are randomized the things, you are whatever the study you have undertaken, whatever the problems you are undertaken, you will follow this study method. Some of the diseases like the which carries the stigma and discrimination, at that time this probability sampling may not work. At that time, snowball technique may be useful. So non-probability sampling or purposive sampling should be done. Apart from this, sometimes if it is a multi-centric study, or the many centers are going to involve, then the multi-stage sampling or the multi-centric center technique, means cluster sampling, that could be implemented. So this sample size and sampling procedures are two important components which mention that the population is selected, so that you are not biased, you are not having any kind of the prejudices in mind, or you are very much that you are doing the your study in the purely scientific spirit. So with that, you ensure that participants could be enrolled properly. At the same time, you are also mentioning the data collection plan, data analysis plan. This collection and analysis plan both requires a justification that my data, the nature of the data, in which you have to write down the clinical research performa or the research tool. Means you are at present moment concept paper, you need not to uh, uh, develop this, but you kept in mind that this whatever the forms, whatever the data, you are ready, which kind of the sample statistics test which you are going to apply. You can also prepare the dummy table also at that time, and you can also kind of analysis plan also you can mention. But this data collection and data analysis plan should be shortly mentioned. And ethical issue, that is a human population protection, that is also important. So the informed consent that you are going to take, that will also mention. And what kind of the which IRB, institutional ethical board, you are going to submit for this ethical clearance. Okay, so this is very important slide, and you must fulfill all these point at the time of the submission of the concept paper. Next please. Thank you. Thereafter, what are the expected benefits after doing this in concept paper? You mentioned these are my methodology. Now, thereafter, you write down that with this, my data collection, with this all, I will fulfill my criteria. I will collect my data. I will analyze my data, and I will ready with the result. Then, at the end, what the benefits means, what the kind of the uh, service gap or the problems which I have identified would be fulfilled. So what action will be taken following the result? So that means that recommendation at the end you are going to do give based on the findings findings of your research. And also you put forward the with the limitation, you can put forward the limitations also, and you can say that okay, these are the few gaps which suggest the research agenda for the future. Next please. Okay, key references. Not more than five, which is very core references which you have quoted inside your in the concept paper. You should mention mostly during the introduction part. Whatever the or anywhere you have used, these references must be noted, and these references must be following the International Committee of Medical Journal Ethics editors. That is ICMJE guideline. Most of the times we are using the one core method to make the bibliography or to code the references so that we can use. Next, please. Very good. At the end, you mentioned the few lines regarding the budget, that budget which you are going to propose. Not is the final budget, but at least you give the outline of the budget. That is that may contain the. Suppose you are going to uh, take the help of some worker, or you hire some worker for the data collection, then you can mention the salary, the TADA. If the field survey is there, then some travel plan, traveling expenses you can mention. You can mention about the laboratory test or some procedures which is required, some consumables. So this kind of the things you mention here, and approximate budget you can mention. Next, please. Okay. This is a slides where you that is mentioned regarding the portal, ICMR portal, where the P forms is there. So P guidelines are there to submit the this kind of the concept paper. So by submitting it, you can also submit your means with that you submit your proposal for the evaluation. So this portal is there. You can use this portal. Next, please. Hmm. So it's the arrow mark is there. Click over it, and then with your credential, you can log in and you can submit the proposal. This template is also given. According to this template, you can prepare the concept paper. Next, please. Okay. So this is a proposal format which is available on the ICMR website, where the title of project, which an introduction, novelty. Novelty means what newer things you are going to do, and their applicability. Applicability means it is whether how it's applicable, whether it is whether this is there some usefulness in there or not, that you have to mention, and description of project with methodology, feasibility, outcome, and budget. So words are mentioned there. According to this limit of the words, you have to prepare this format. Next, please. Proposal format. This is a STS proposal format. This proposal format is for the medical student undergraduate. Every year, ICMR open up this portal for the STS project submission, and our many UG students are also submitting it. And now ICMR has increased the timeline for completion of this project, as well as the amount of the remuneration or one kind of the scholarship, research scholarship is also increased. It's up to 50,000 rupees now they are giving. So ICMR provide 50,000 rupees to undergraduate students, which is a great help to them to undertake the research, as well as it gives the score. Once they complete the project and get the certificate of ICMR, that will be that will increase their CV for their career builder. So again, this is a proposal format. Next, please, for the STS. Fine. So ultimately, why the concept paper is? Concept paper is to organize your idea. Number one, if you are organized with your idea, then it puts just in the right words on the paper and stand out among the competition. And at the end, expect some positive feedback from the funding agency. So concept paper is made to give birth to your idea, and that's all about the concept paper. I hope any query, any question, I am ready to answer it. Next, please. Okay. Any query, any question? Am I audible?
Yes, sir. Yes, sir.
Okay, okay.
Thank you very much, sir, for this very informative and helpful session.
Thank you.
I think we don't have any questions, so we would carry forward this session. Thank you very much, sir. Now I would like to welcome Dr. Kedar Mehta, sir, Associate Professor, PSM Department, GMERS Gotri, Baroda, for highlighting the importance of topic of elements of a protocol for research studies. Please welcome, sir.
Yeah, thank you so much. So can we have the presentation? So at the outset, I think Dr. Atul sir has already mentioned about the concept paper. So protocol, much of the task has been made easier because protocol is nothing but the expansion of the concept paper. So as Atul sir has mentioned in the previous session that whatever concept note, what you have a concept paper, what you have prepared. So when you try to expand that in the form of a protocol, so protocol is nothing but a planning how you're going to do the research, right? So it is like designing a map, or as you say, when we design a house, then before constructing the house, we create a roadmap or we create a blueprint or the plan. So similarly, before doing research, We try to put it on paper. We try to do how we are going to do the research, why we are conducting the research. So when we are putting all these components, right, in great detail, that becomes our protocol. The one thing is the protocol is it is always in future tense. So what common mistakes I have seen in the students is that they come up with a protocol in which they have just copy pasted and it is was done. It is not was done. The protocol is for future, like how we are going to do the study. So this study will be conducted, where it will be conducted, how it will be conducted, right? So protocol is something for the future tense, that how you, it should be in the future tense, like how you're going to do a study. So next slide, please. Let us quickly see the steps of a successful protocol. So there are 7 steps. Number first is we identify the topic or the question in the research objectives. I hope we all are aware with the FINER and PICO concept, that is population, intervention, comparison, and outcome. So that is step number 1. So after identifying that, we go to the next step, that is outline a one-page concept paper, which Atul sir just now explained us that how can we make a one-pager concept paper, right? After concept paper, we try to prepare dummy tables, like how my result section would look like, or how am I going to present the findings of my research. So that is step number 3. Once these 3 steps are ready, the fourth next step is we are starting to make our draft protocol. So that is step number 4, that is writing the draft protocol. Step number 5 is we prepare instruments and annexures. Step 6 is once we have prepared this entire protocol with all annexures, with all attachments ready, we go for the submitting to peer review. Means you ask your departmental colleagues, your peers to look at the protocol. They can analyze. If there are any questions, they can ask you. You can try to modify accordingly. And finally, you submit to ethics committee for approval. So these are the 7 steps of a successful protocol. Now coming to BCBR exam, sometimes they ask the sequence of this as one of the MCQ, like 1, 2, 3, 4, which is the correct sequence, right? So first is objectives, then concept paper, and then protocol. Sometimes it is given objectives, protocol, concept paper. That is wrong. So this slide is very important for an MCQ purpose, where sometimes they ask the sequence of this successful protocol formation. Next slide. So as I said, the first draft of the protocol is nothing but the concept paper which is ready. So that you have to use this concept paper, outline the same thing which is mentioned. That is background, that is introduction, objectives, number 2. Number 3 is methodology in detail. Number 4, what are the expected benefits? And number 5, what is the budget? So these are the 5 main points what we try to explain in this protocol. So that was a concept paper outline also. We will try to expand each one of this. Concept paper एक page में ही था. So that one page we are trying to now expand it up to 2000 words, right? Usually our protocol does not exceed more than 2000 words. And specifically the introduction or the background section should be less than 20% of the length, right? So if you say for 2000 into 20, it comes around 400 words. So it should not be more than 400 words. Introduction section should not be very lengthy. And it should all contain 5 key references was mentioned there. Here you can extend up to 10 key references in the protocol. Next slide. So the most important part of the protocol or the heart of the protocol is the methodology section, because in background you are just explaining why you are conducting the study. It should be only in 400 words, but when we are trying to explain the methodology, it should be as detailed as possible. Sometimes you feel कि ये थोड़ी बताने की चीज होती है तो समझ जाना ऐसा ही करना होता है, but that is not the case. We try to explain every step in great minute detail. Say for example, if I want to explain how am I going to take blood pressure of the patient, I will explain that the patient will be asked to sit for 5 minutes. After that resting, the patient will be sitting in this position. Blood pressure instrument, वो कौन सा instrument digital वाला use करने वाला हूँ. So everything in the right arm I'm going to use. So all these minute details. I'll take 2 readings, then I'll take average of these 2 readings. So you know this is a standard procedure for measuring the blood pressure. But still, in the protocol, we try to explain this as detailed as possible, right? So looking at the quick outline of this methodology section, what all points you should include. Atul sir has already mentioned that all these points. So I'm just going to quickly brush up. First is the study design, right? The second is the description of the intervention, how the process in detail. Third is study population, right? Then the next is operational definitions, the sampling procedure, the sample size, the data collection, the analysis plan, how you're going to implement this, that is project implementation plan, or the quality control or quality assurance, how you're going to maintain the quality during the process of data collection or the methodology section. And the last part should be the ethics part, that is human subjects protection. So these are the brief headings under which method section. So one by one, I'm going to quickly go through each of these. Next slide. Right, so there should be a study design paragraph in which you should clearly mention whether it is an observational or an experimental study. Again, further subdivide whether it is a case control, cohort, or cross section. I'm not going to discuss that because that has already been covered in the previous sessions. So just you need to ensure that your study design should be as per the objectives, right? If I want to compare two drugs, of course I'm going to do for an RCT, right? So whenever if I'm going to find prevalence of the disease or prevalence of the condition, I'll go for a cross-sectional study. So make sure the study design is in alignment with the objectives of the study. Also to describe whether it is retrospective or prospective study. If you're going backward, it would be retrospective. If you are going forward, right, we try to go look in future, then it should be a prospective study. Next slide. Then you're going to describe the intervention, right? So if the intervention is planned, if your study is interventional study, it is not observational, then explain that intervention in detail. Like who are going to, means whom you're going to give this intervention, what is the intervention, when you're going to provide the intervention, and how you're going to provide the intervention. So say, for example, I'm doing a study among pregnant women and I'm looking at the compliance of their iron folic acid supplementation. So who is here? The pregnant women whom I'm going to see whether they are taking iron folic acid tablets or not. So who is pregnant women? What I'm going to do intervention is iron folic acid tablet. What is the 60 milligram of elemental iron? Folic acid 500 microgram, right? I have to explain that in detail, whether it is daily or weekly supplementation. So what I'm going to, that has to be explained in great detail, right? How many, for how much duration? So for 6 months or for maybe 9 months, what is the duration, right? And how, right? So how this is to be, how you're going to give, as I said, oral route. So if I'm looking at some FCM nowadays, the newer version, then if that intramuscular, or how am I going to give that, or it is an intravenous. So all this intervention has to be explained in great detail here. That is the second paragraph. First was study design, second is intervention. Next slide, please. Next is study population, right? So make sure the study population should be very clear. So not only pregnant women here, it should mention time, place, and person. Person is pregnant women. Place. So pregnant women coming to Gothri Hospital, Vadodara. So that is a place, right? Time during January to March 2026. So I'm going to do a future study where all pregnant women coming to my hospital during this particular 3 months duration, that becomes my study population. So ऐसा नहीं है कि बोल दिया pregnant women में करना है, but you have to be very much specific that what is the study population. Make sure what are the inclusion criteria, what are the exclusion criteria, right? Like those are not giving consent, I will exclude them. So mention, you have to mention that here. So don't confuse the study population and the study sample. Population is this, but the sample would be out of these, those who are included, those who satisfy your inclusion criteria, that would come up in the next slide. That would be my study sample. Like say, for example, 1,000 women coming during this 3 months period in my hospital, but out of that, only 400 gave consent. So my sample would be now 400. It won't be all 1,000 women. That is my study population, but sample is a part or a subset of this study population. Next slide, please. After that, we need to explain operational definition. So Atul sir also talked about this. Operational definition is like what definition I am going to use in my particular study. So say, for example, WHO defines anemia as less than 11 gram percentage. But in Indian context, if I want to say that for me, anemia would be less than 10 gram percentage. So that is an operational definition for my particular study. It is not the universal definition of anemia, where it is less than 12 or less than 13, less than 14 in this and less than 12 in males. So something like that, if you have the less than 12 in females and less than 14 in males. So if you have, that is a broad definition. But operational definition means in this particular study, how am I going to define my outcome? मैं कैसे measure करने वाला हूँ, right? Say for example, hypertension. What is my operational definition? That more than 140 by 90 would be hypertension. 130 to 140 would be pre-hypertension. So make sure you define that outcome variable in great detail. That is the operational definition paragraph. Outcome, your exposures, right? You have to be very much clear and specific. You can also give references if applicable, that I am going to use this particular guideline for obesity. Like say for an Asian classification available hai, so that definition I'm using. American Heart Association wala मैं use कर रहा हूँ for hypertension. You can mention that particular thing in operational definition. Next slide. Coming to the next, after design, study design, sampling, and the next would be the sampling procedures, like what type of sampling method. So sampling procedure is how am I going to sample size अगर 100 हो गया, but वो 100 में कैसे लेने वाला हूँ मेरी study में. So that is a sampling process. It would be convenient sampling, or it is randomly you're going to take the sample, or you have a systematic sampling. So all these sampling methods, I think there would have been separate session, but you are going to I'm not going to explain that, but just you have to mention here in the methodology section that which sampling method are you going to utilize in your particular research study. Here also you can provide references if needed. You have to explain randomization also. If I say random sample, but how random? What is the method of random? Whether I used computer softwares to generate random numbers, or it was by picking up the cheats, right? So what random method or how randomization was done, or how we are going to do that needs to be explained here in the sampling procedure. Next slide, please. After that, you come to the sample size paragraph. So how did you calculate the sample size? Whether it was with a formula like 4pq upon L square, or you use some software to estimate your sample size. So that needs to be explained very clearly here in the sample size. Here also, if you took a reference of a previous study, that in the previous study, 30% compliance was there to iron folic acid tablets. And I want to see what is the compliance here. So 30% ko reference leke, and now in my particular study, how much sample is coming. So N may 4 PQ upon L square. So P is 30, Q will be 70. And if I allow 5% error, then L square is 25. So maybe my samples come around to 400 women. So something like that, you need to explain very clearly the calculation of the sample size. Next slide. Yeah, then I'm going to explain the data collection process, like how will the data will be collected, right? Who will be collecting the data? Like whether I'm going to collect the data, or my team or my research staff, तो उसका training हुआ कि नहीं? What instrument will be used to collect the data, right? Whether they're going to use in the tablets or online data collection form, Google Forms, I'm going to collect the data. So data collection process, whether it is primary data collection or secondary data collection, right? So everything, type of data collection method, like how you're going to collect the data, everything needs to be explained very well in this paragraph on data collection. Next slide. So once you have collected the data, your next plan would be data analysis. So how you're going to analyze your data? You will do data entry in which software? Maybe in Microsoft Excel, you're going to do the data entry. Then you have to mention that which software you will use, right? What recoding you may do. So male is given, I'm giving code 1, female, I'm giving code 2. So if I'm doing any recoding, I have to mention that. Analysis plan, descriptive and analytical, both needs to be explained. How I'm going to describe my parameters. So maybe with the help of percentage or mean SD, right? Or with its prevalence. And analysis, how I'm going to do my data analysis, like analytical statistics, which statistical test I will apply. So chi-square test or t-test, right? Or I'm going some multivariate analysis like logistic regression. So everything, how I'm going to analyze the data, that has to be explained in this data analysis. Next slide. And the next would be the project implementation plan paragraph, right? So detail the steps that will be used to ensure data quality at all stages. How I'm going to address the data quality has to be ensured. Like data collection mein, what all things I'll take care of. If I'm doing double data entry, then I'll explain double data entry and validation was done, right? Then reporting, which guidelines I'm going to use for reporting. That is important for MCQ for BCBR. If you see, remember, there are consort guidelines, right? There are correct guidelines for qualitative methods, right? So all these guidelines, I'll show in the last slide, which are the guidelines. So I have which reporting guidelines I'm going to strobe guidelines. So कौन सी guidelines मैं use करने वाला हूँ, that I can explain, mention here. What are the roles and responsibilities of investigators? You have to mention very clearly, like how confidentiality would be ensured, right? Data will be password protected, files would be used. So all these things you can mention here, right? Coordination of project activities, the project timeline or the Gantt chart which is used. Like this would be the phase where data entry will be done. This would be phase data analysis, right? When I'm planning to do my data collection. So everything should be explained here in this project implementation plan paragraph. It is like a quality control or quality assurance. How I'm going to ensure that all this work has to be of good quality, right? Next slide, please. Then there is a human subjects participation paragraph. That is, this is about ethics, right? So what all steps I'm going to ensure while doing the study to protect the study participants, how I'm going to minimize the risk, how I'm going to ensure privacy, how I will ensure confidentiality, how I will ensure if there is any compensation, what type of compensation, how much compensation, what is the method of taking this informed consent in the local language in the presence of the witness, right? And of course you have to mention that from which ethics committee we will take the approval. Everything about ethics related should be mentioned in this particular paragraph. So perhaps this is the last slide or the last paragraph of the methodology section. Next slide, please. Right? So after this, we attach all the annexures. Annexures would be like data collection instrument कि मैं कौन सा questionnaire use करने वाला हूँ, right? If it is a qualitative study, what interview guide I am going to use? What are the set of questions I will ask to the participants, right? Which questionnaire tool I'm going to use, like Google form अगर है use करने वाला हूँ तो वो वहाँ attach करना होगा कि this Google form I'll be using. These are the questions which will be there. So these are all annexures things. Annexures means all those extra attachments which you are going to attach with the protocol. Next slide. Apart from data collections, other annexures could be like SOPs. अगर आप कोई use करने वाले हो तो standard operating procedures of laboratory testing and all that can be used. Then coming to training framework, अगर मैं ट्रेन करने वाला हूँ for all the data collection staff, तो वो कौन सा मैं use करूँगा, that I have to explain, that I have to be explaining there. Then we have a participant recruitment manual. If you have adverse event management form, if you have consent form in English, Hindi, Gujarati language, that you can explain. Study management form. So all these things can go up as an annexure file at the end of the at the end of the protocol, I mean to say, right? Next slide, please. So once everything is ready, you finalize the protocol, you have introduction, methods, all these annexures ready. You can take peer review to obtain feedback from your colleagues and experts. Just show them, right? See, that is very important. Although it is not formal, but informally they'll tell you कि ये मुझे समझ में नहीं आ रहा है, so that you can explain in detail. Okay. Then finally you submit it to the ethics committee and make sure you archive all the drafts of your protocol. It may be V1, V2, V3 कि मेरे colleague ने देखा तो that उसमें edit किया मैंने तो दो second version बना, third मुन्ने किसी मेरे professor को दिखा तो वो third version बना. So like so on and so forth, I can have versions of protocol. The first would be very rough draft protocol, but then you can go on minutely, you can go on improving the protocol versions, right? So next slide. So this is what I was telling. These equator network.org, यहाँ पे reporting guidelines में है. So if you see consort guidelines is from RCTs for observational studies, right? And correct guidelines is for qualitative studies. So these are the this is the website from where you can get the reporting guidelines. So you can use in the protocol while reporting how you're going to report your study. So any of this framework you can use while you're reporting your study in future, right? Next slide. So that's it. This is just a life cycle of research, the same thing. To have your research question, then your objectives, your analysis, you prepare the tools, and then on the right side, you collect, analyze data, you formulate the recommendations, and finally you inform the stakeholders. So this is the entire life cycle of research. Okay. And thank you so much. I think that's it from my side. So if the protocol is well structured and well defined, half of the task is done, right, of the research. So the protocol is the main foundation or the pillar of the research thing. So thank you so much, and I'll be happy to address if there are any questions from the participants. So You can write in the chat section also.
Thank you very much,
Thank you
sir,
very
for
much, Dr.
enlightening
Chira.
us.
Yeah, thank you, sir. Thank you so much, Chinmay sir.
Any questions, please? Okay, since we have no questions, we are moving forward with our session. Thank you very much, sir. Mehta, sir. Now,
Thank
I
you so
would
much.
like to welcome Dr. Chinmay Shah, sir, Dean Government Medical College, Bhavnagar, and OSD for Research at DMER, Gujarat, for explaining us about the topic of publication ethics. Please welcome, sir.
Thank you very much, Divyata. Am I audible?
Yes, sir.
Yeah. So can you share the screen? Share my PPT from your computer. Yeah, thank you very much, Divyata. So, dear friends, now we are coming to the end of last three sessions of the BCBR. Wishing all of you all the best. So now what we are going to discuss is three sessions. Out of that, one session I am going to take, that is ethics, publication ethics. Next slide. Can you just go down? See, when we are talking of publication ethics, there are few important things comes. Number one is authorship. Second is plagiarism. Third is data fabrication. Fourth is conflict of interest. So these are the four things which are more important that you to keep in mind. So at the end of session, we would like to know various ethical issues, and you can use the guideline available for ethical practices. Next. You can go to the next. So this slide basically says that starting from formulation to operation till the data collection and publication, different ethical breach can happen. So what are they? So starting with the first. Divita, can you just go? Yeah. Next, Divita. Yeah. Next. Okay. So why we use previous slides? These are the slides which says that why we have to do publication. That is maybe because of NMC requirement or maybe because of institutional requirement. Okay. So these are, as we have discussed, components of publication ethics, like breach of confidentiality, ethical review, fabrication and falsification, authorship, plagiarism, ethics related to submission and conflict of interest. We will see each one step by step. Next. Diveta, next. Yeah. So first is ethics review and breach of confidentiality. See, as per the NMC guideline, it is mandatory. Not only NMC guideline, ICMR guideline also, it is mandatory that each research undergo ethical review. We have seen many times that either it is not submitted for the review and research has been conducted, or not proper review has been conducted for any particular study. So that is the first breach which can happen. So we have to keep in mind that when any breach into the confidentiality happen because of sharing the protocol to outside the institution by somebody without the consent of institution or PI, it leads to breach of confidentiality. So that also we have to take care. Next. Next is the data fabrication and falsification. So in that case, we have to keep in mind that you should keep only and only main data which is available. Okay. So what is the fabrication? That the study has not been done and you have generated, or when it is manipulated, it is known as falsification. So this can be one of the questions, that what is fabrication and what is falsification. Okay. So this is extremely seriously misconduct. Why? Because what is happening? That one publication happens due to data falsification. You consider that such 4 or 5 publication happens. Based on that, somebody will conduct meta-analysis and systemic review, and based on that, ultimately guidelines are created. So this is the very severe misconduct if you are doing fabrication and falsification. Next slide. Okay, so this is an example again. Example one is a final year PG students come to me requesting to analyze the thesis data. He also asked if I could make some significant result, though it is not there. So it is a falsification. And curiously, I asked how he has collected the data. To my surprise, he revealed the data taken from his senior thesis fabrications. Next slide. Similarly, the Kyoto University finds stem cell researcher guilty of data fabrication. Why? Because the scientist was a member of stem cell research team led by Nobel laureates, and he has taken that data. So here comes two things: data fabrication and also a breach of trust of a common people or loss of time and resources of other people. Go to the next slide. Authorship. This is the most important things where most of the dispute happening between the teachers. So number one is who is the author. So as per the ICMJ guideline, if all the 4 criteria is met, the person is authorship. Author means he is a part of development of protocol. He is a part of collection of the data. He is the part of analysis and interpretation, and he takes responsibility for whatever is done. When we say data collection and interpretation, it also includes writing. So when the person is involved in all 4 things, then he is considered as the author. There are certain things where we can give an abnormality or we can say publication misconduct. Number one is a ghost author. This author is not there. It is usually paid author who is writing but who is not there. Then guest authorship. My HOD who is not involved, I am writing his name. My wife is there in the other department. I am putting his name. So that are the guest authorship. Next. So this we already discussed. Next. Submission. So there are 4 things which we should avoid. Number one is a simultaneous submission. We submitted multiple journals, so don't do that. Duplicate. Submitting a new manuscript with the same hypothesis and with little difference in the data discussion and conclusion. The next is a self-citation. So what we are doing, I am citing more and more my research. And lastly, publication in predatory journal, which are not under either UGC care or authorized institute or authorized, we can say, repository. So if you are submitting predatory journal, usually it is not unethical on your part if you are not knowing, but ultimately people will consider that you are knowing and you have submitted in predatory journal. Next slide. Plagiarism. This everybody knows. Copy paste. So either you are directly copy pasting, then whole plagiarism. If you are doing simple change, then it is also known as plagiarism. Then, as we have said, self-citation. I am if I am doing my own, I am sharing my own write up again and again. It is also known as a plagiarism.
बीच बीच ही बच्चे हैं I think we have some network issues. Kindly wait.
Hello. Can I add a point here regarding UGC guideline for journals?
Since we have some network issues and Chinmay sir is not able to convey his lecture, we would like to forward our session and move forward to ma'am. So now I would like to welcome Dr. Kalpita Shingarpure ma'am, Assistant Professor PSM Department, GMC Baroda, for teaching us about the topic of manuscript writing. Please welcome ma'am.
Thank you so much. Okay, so actually we are outside, like along with Chinmay sir, even I am outside. So please let me know if the network stops or anything because we are on phone. We'll be talking about manuscript writing, which is about what all are the important components of a manuscript. Can you go to the next slide, please? Okay, so basically we are going to see what all should come in a manuscript. So please remember, manuscript is something which once you have completed your data collection, you've done your analysis, how you're going to put forth the results along with everything. You had made a concept note, you had made a proposal which stated the introduction, the methodology, everything remains the same except what you write or add in your results section, as well as you update your discussion. Another thing is your methods go in the past tense. So these are the basic three things which are going to happen in your major manuscript. And again, we add further information or further changes or tweaks which we have done in the methodology. All those should be mentioned in your manuscript. So articulating this content to deliver the message effectively is what is a correct manuscript writing. Next, please. Okay. So what is a manuscript? It is a document which is submitted for publication. So please remember again, manuscript would be a very concise and very short version of your thesis presentation. A scientific manuscript can be of different types. One is the original article, where you have actually taken the data collection, you have made the analysis, you have done the work, and writing it as a prototype. The second part is a review. So review can be a review of multiple different articles which are compiled together, having a similar objective or maybe having similar findings which you want to concise and give your input. But it could be either a simple review which has maybe last 1 year data all published, or it could be a systematic review which again is a separate topic which is taken in a more systematic manner. It could be a correspondence, like you are trying to answer. Suppose there is a query on your publication and you want to answer, or someone has put a false claim, or someone has made an argument on your findings. You can put this information. The second one is a perspective. The fourth one, sorry. It means I am just giving my perspective on a particular topic. It could be a new topic, it could be an existing topic, it could be a talk about what new perspective or what my thoughts I have on a particular drug or a particular system or a particular mechanism of action. And the last one is an editorial. So it is basically a letter to an editor, which is a very one-page concise format, which gives your viewpoints, but in link or in liaison with some underlying statements or facts. Next, please. Okay, so before we begin writing, we need these three things. We need our tables and figures. So that is basically the analysis and your completed filled table of analysis as well as figures. The next thing is we need some central 2 or 3 ideas. So when I'm making a manuscript, basically what I'm doing is I want to put it in a publication. So it should be in a proper journal or a pre-decided journal. I should know what all requirements are there of that journal for giving different headings for my manuscript. Again, searching for that, searching for instruction to authors, downloading that, and then putting my manuscript in that particular format is the correct way to proceed towards writing a proper manuscript. So some papers or some journals will require some key points, some recommendations, some highlights. So accordingly, we can glean and we can take out those points from our findings. And we need an outline of argument. So basically, if I have a result, if my result says X percentage is my proportion of outcome, and I have another study which says that it is 10 times more in that study, or maybe in another study it is 5 times less than my study, I need to find out, I mean, I need to write these differences, but again, I need to say why. It could be a difference in my methodology, it could be a difference in the way I have taken data, it could be a difference in my population in which or sample in which I am studying. So those things will come in my arguments. Or I could write why I have this finding. It could be because of certain things, in addition to not just comparing and contrasting it with other publications. So these are the three things which we need to have on hand before we start writing the actual manuscript. Please, next, please. Okay. So we'll be talking about organizing ideas logically and sequentially within a defined structure. That is the main structure of the manuscript. Next, please. Okay. So I need an IMRAD. You would have heard about IMRAD structure or the IMRD structure. So introduction. Why did I start writing this topic? methods, what did we do? So this we have already seen in how do we write a concept note and what all points I need to cover. This is the same thing, but in addition to my concept note or my protocol, I will have the main chunk that is of the results. So what were my findings and what do those findings mean? So when I am writing a manuscript, my base is my protocol or my concept note, which is expanded. I need to add new papers or new articles or new references if there are any, and then I will add on to results as well as discussion. Next, please. Okay. So this is one example which is going to be taken throughout the topic presentation. So one is one article which has been given, that is impact and operational feasibility of TrueNut under the India's RNTCP program, which is the TB program now known as NTEP. Next, please. Next, please. Okay, so we've already talked a bit about introduction in the earlier sessions. So what is introduction? I start from the global scenario. I come to a state specific scenario. I come to the local place where I'm going to do the study on and give the brief facts. So that is the zooming in or the background. I talk about how many such studies have been done, what have they studied, and what are the loopholes or gaps in earlier studies or limitations, which I'm going to take care of in my own study. So basically, introduction is the salability of my article or my paper or my research project. Why am I actually doing this research project? Followed by this, I also need to write what is the actual rationale. Is it feasible? What will be the long-term impact of this study? And my introduction usually ends with a statement which gives the objectives of the study. So this is the package for an introduction. When I'm writing a manuscript, the introduction should not be more than 200 to 300 words. Next, please. Okay, so this is just an example of the introduction. I would be skipping this for a lack of time. We have just 15 minutes, but you all would be shared with this presentation. It is available online and you can go through how the introduction is written. Under methods, you need to explain what was actually done in your study. If there is a new method, you need to explain that. If there is a new equipment being used, you need to explain that with proper references. If there is a new technique or a new study design which you are implementing, again, that needs to be explained. Basically, method should be written in such a way that if another person needs to replicate the same study in your in their setup, they are able to do it and they would get findings which are in those 95% confidence limits provided they are done accurately. So methods will vary from other study to study. Sometimes in my introduction also I may write that earlier study was a cross-sectional study, but I need the study to be done more in a more proper manner to study the causal association. Hence, I'm going to do a cohort study or a prospective cohort study. So this is how I need to focus on my methods. My methods should be relevant to my objectives. Next, please. Okay. So under methods, we have certain subheadings. That is the study setting. Study setting should be first is the general setting and the next one is the specific study setting. So general setting basically means how many, in which place or in which area am I doing the study. Specific setting may mean if I'm doing a microscopic study, I would need to know which microbiology lab, which machine is routinely being used, what is the turnaround time of those machines. All those basic information should be included in our settings. The next part is the study design. So whether I'm using a cross-sectional method, whether it is a case control study, whether it is a cohort study, and then I talk about what kind of cohort, if there is an RCT, whether there are two groups, what kind of matching is being done. All those things will be included in my study design or in the study procedure. Operational definitions are, some definitions may be by default. Some could be my working definitions of, say, if I'm talking about loss to follow-up, what is my definition? Is it different from a programmatic definition? I'll need to specify that. This can either go at the end of methods or it can come between the study design and the sampling. The next part is sampling strategy and sample size. So maybe I'm taking routinely collected data. I am doing a time-bound study. Then I need not have any sampling. But if I am taking some specific sample size, then how is the sample estimated? If I have a sample size of 1,000 and I have a duration of 6 months, how will I take the sample? How will I collect the sample? Whether I'll go to the OPD daily alternate days, or on days where there are specific working people or specific OPDs being done. I need to specialize, I need to specify on what all aspects of my sample size I'm going to cover. I also need to add whether there are any inclusion or exclusion criteria to select my specific samples. For the study procedure, again, if there is a blood test being done, if I'm going to measure height, if I'm going to measure weight, how is it going to be done? How much training, to whom am I going to train, or what is the duration of the training? How will I look at whether the people who are trained have got what I need to inform them? So all those parts will come under your study procedures. Next is when and where will I do the data collection? What process will I follow? Whether there will be an informed consent, whether there will be a written consent, whether it will be assent, so on. All those things will come in your study procedures and human participant protection. When I talk about data management, one thing is, even during the protocol stage, we mentioned that your introduction should be as per your objectives. So if I have 3 objectives, let the flow of introduction also go as far as possible in those objectives, in form of that objectives. Let my methods also remain in the same way. I can have a tabular form of stating that this is my objective 1. For this objective, I will take an interview. For the objective 2, maybe I need to go back to the records and take data from those records. And maybe for objective 3, again, I need to do a on-site data collection, or maybe for objective 3, it will be lab investigations. So how will that data for that particular objective be collected? What will be the various variables required for that data? And what kind of analysis will I do for that particular data? So all that comes under the data management, collection and analysis part. When I talk about human participants protection, it is mainly related to the ethics and the consent part, which we have already covered. I think it was in the previous lecture. It will be covered in detail if the network is uh, comes back well again. Next, please. Okay, so this is an example of methods from that same topic, from that same paper. So you can see study settings, study design, data accuracy and checking. Nowadays, people try to focus on double data entry, how many times that data is entered. If there are any key variables, then we focus more on entry of those data variables, how is it checked or counter checked, and so on. The next is operational feasibility, data analysis again, and then the operational feasibility and the ethics statement. Next, please. After the introduction and the methods and the operational definition, sometimes it comes as a separate subhead, we have results. So in the results, be very crisp, be very concise, especially for a manuscript. One thing is, focus on what you want to inform. So usually your first paragraph should be on what patient cohort have you, what patient sample have you taken. If there is a cohort study, then what are the main characteristics? If there is an RCT and you have 2 groups, just see that they are comparable at the baseline. So those things need to be presented. In results section, usually we focus on 3 to 4 objectives. So the number of objectives, those many should be the paragraphs in the results. You should have tables, figures, images, based on what kind of data you want to explain, or you want to put it in the results. See to it whether they are more specifically shown in a table or in a figure or as an image, or they should be written out. So based on that, we need to write. Usually in a thesis, what we do is we write that paragraph, then we write the entire, we write up the entire table. We again write every single column and row of the table as a paragraph. We put it as a figure also, or maybe as an image. But when we talk about a manuscript, we need to take care of the word count. So look at what reflects best your results. Do not duplicate your findings in tables as well as in images as well as in the paragraph. In the write-up, try to focus only on those points which you want to highlight, which could come in your discussion part, or which could come up in the arguments in the discussion, or which are the main highlighted findings of your study. You should not have any interpretation or comments in the result section. So if I say that odds ratio for a particular group who was smoking, the odds of getting lung cancer is twice than the non-smokers, I need not explain why or why this finding came, or because my sample size was higher under the results section. It should be under a separate head of discussion. Sometimes in the manuscript, for certain journals, they may say that results and discussion may be combined. In that context, we may have a combination of the interpretations and comments. Remember, results are the only part where we will not have a reference because these are the findings from our own study. Next, please. So this is an example of the results. You can see there is a brief summary of data accuracy, a brief summary of impact assessment, then one graph or a figure and one table. So results should be as concise, as crisp, and as small as possible, particularly highlighting on your key findings. Next, please. So under discussion, so after the results, again, I go in the flow. I have suppose I have four objectives. I have 4 paragraphs for results. I keep at least 4 paragraphs for the discussion section. The first part of my paragraph of my discussion should give a key or summary of all the findings of the study. The next is I can have it paragraph wise for each of my objectives, along with some comparison or contrasting studies which reflect on my findings compared to the other studies, and also writing why, what is the reason? Is there because of the change in sample size, or the change in methodology, or the change in the study population, or so on. And it can also be my hunch. I could say that my findings are so and so, mainly because probably my study sample is from a tribal region. Maybe my study sample focuses more on those who are at home compared to those who are working, and so on. So it depends on the context of my objectives and briefly what hunch I may have. Again, in the same loop, I can write that, okay, this could be because my sample size is smaller. I could do a study on a larger sample size. So I can either interpret, infer, compare, and put it in my limitation or put it as a strength of the study in the same paragraph. Or I can have different subheads under the discussion also, stating the summary, stating interpretation and inference here as based on my results, comparing it with different studies, and highlighting a separate para for strengths, highlighting a separate para for the limitations of my study. Later on, I can have conclusions and recommendations. Again, most of the manuscripts, as I said, we need to look at which journal I'm going to submit to. And based on that, I will need to find out what is the caricature or what is the, the point-wise system for my particular manuscript for that particular journal. Next, please. Okay. So this is again a short example of what discussion they have written. So the first paragraph gives a summary. It gives the key findings again. Maybe this may be a bit of repetition as per our results. And then followed by that, it is interpreting and inferring. So I got an odds ratio of this much. It could be because of this. As compared to other studies, it is somewhat higher or somewhat lower. And probably the reason could be so and so. So this is how I can write my discussion, followed by conclusions. Next, please. Okay. So after this, when I'm completely written the manuscript, the next part is I should be writing the abstract or summary. Most of us always do. We write an abstract and then we start expanding the manuscript, but it should be the other way around. Although while submission, first the journal will ask, the portal will ask you to enter the abstract and then enter the other components of the manuscript. But abstract should be written after the manuscript is completed and structured. So abstract is a miniature part of the manuscript. Sometimes they may ask you about introduction, results, introduction, methods, results, and conclusion as 4 heads. So that becomes a structured abstract. If it is a free flow, if it does not require those headings and I just write it as a paragraph, that becomes an unstructured abstract. It is the most commonly read because most of the articles, if they are paid versions, it is the abstract which is open to read. And based on the abstract, people would decide whether they need to download the article or whether they need to buy the article if it is a paid version, and so on. So please make sure that abstract gives what are the realities of your findings. It should not be something which is a hyperflation or just a generalizable result. And people may, just based on those things, they may be way led to a wrong interpretation. Abstract summary, again, it's usually 350 words. Some of the journals nowadays will have 250 to 300 words. For your NPTEL exams, you should remember these word counts. For an abstract, it's 100 to 350 words. Some of the articles at the end of the paper or manuscript, they will say that we need a plain language summary. So again, that is something, some sort of an abstract, but that plain language summary is usually 100 words. Next, please. So this is an example of a structured abstract because you can see the background, the method, the result, the conclusion headings. And after, next please. Okay, after this abstract, the second part comes is the keyword. So first we'll have the title, then the abstract, then the keywords, then the actual manuscript begins. Under the keywords, usually what I would write is what are the keywords which will help me pick up that article if I'm going on PubMed or if I'm going on Google, etc. And sometimes some people think that keywords should be those words which are similar to what are the main keywords, but they are not coming in my abstract or in my manuscript. So and another school of thought is that I can put keywords, those keywords which should actually be picked up in the PubMed as a mesh term. If those of you who you are aware of mesh terms would understand this. So if I'm putting TB and in my abstract I'm using tuberculosis, that would mean that I'm able to pick up the key terms also, or the mesh terms also. If I'm doing a workshop and if it is affiliated to a particular institution, even keywords can be put as those institutions or workshop. I put that keyword, I'll get all the papers which have been an output of that particular workshop. So this is how keywords work. They help you your article to be cited more easily or searched and got more easily. Usually we have 3 to 5 keywords, or some journals will ask you for 7 keywords. Next, please. After the complete manuscript is over, the next part is the references. So we have talked about how to do reference management. Basically, I may not be able to cite. Usually, we in a thesis, I may say that okay, proportion of TB is this much percent. A study in Andhra Pradesh shows that the proportion is this much. Gujarat shows this much, and I can write a complete paragraph only on proportions, and I can cite those results. But if I'm talking about a manuscript, I need a proper word count. And what I can say is that the proportion in Asia or in Indian continent ranges from 18 to 35%, and I can put 10 references in the bracket. So references are something which will help me to take up all those points in case someone is interested to get data from that particular area. So they should be relevant. They should be usually in the last 5 years, and it is actually a management of your bibliography in the number wise section in the way it is cited, or through in-text citation. Most of the journals nowadays will have the numerical citation, and it is not in text, it is at the end of the references. Usually it is the Vancouver style which is followed by most of the journals, and reference writing is now quite manageable and easy with the help of certain online available softwares. Naming a few would be Mendeley, Zotero, etc. Next, please. So this is an example of references and in-text citation. In-text means that it is, I mean, on one page, if there are 4 citations, at the end of the manuscript, there is a reference, and all those references are cited as per the number, are numerically given at the end of the manuscript. Next, please. Okay. So discussion, usually we say that it should be in the argument matrix. I have already discussed this, that it respects the structure of various sections, develops, I mean, as I said, give the findings, give the comparison contrasting, give probable reasons why you have found those particular findings, and then try to look at whether it is because of your limitations or whether it is because of the strength of your study, and how would you propose to take it forward to improve the limitations, or to take more important, I mean, take more weightage from the strengths of your study. So this is how the argument matrix is used to prepare the outline of the manuscript. There are a few next few slides which show how the arrangement of that matrix is. Can you go to the next slide, please? Okay. So this is the thing. As I said, usually would go with 3 to 4 objectives. So accordingly, I will have 3 to 4 ideas of what are the key findings in my study. Suppose if I'm talking about loss to follow-up in TB patients, and I have a finding that females are more loss to follow-up, then that could be my idea one. I would say that smokers are more prone to getting poor outcomes in TB as compared to non-smokers, or more loss to follow-up as compared to non-smokers. That becomes my second idea. So on. So based on my 3 or 4 ideas, I also talk about it in my introduction. My method should have those variables. My results should have that particular paragraph for that particular finding. Again, it should reflect in the discussion and limitations as well as the conclusion. And if there are any recommendations to sort that out, it should be there. So basically, it should be a flow and in a sequence, a sequential flow for each and every aspect based on those 3 or 4 ideas. The next slide will reflect that much more clearly. So I'll just keep this for a few seconds. Right, so this is the direction that the paper will follow, and this is how the person will read. So introduction, I talk about idea 1, 2, 3. I go to methods, I again talk about idea 1, 2, 3 in the sequence, and this is how the entire argument matrix will go. Next, please. So then these are some optional sections. So we have talked about the IMRD. We have talked about references, about abstract and keyword in the front, and references at the end. Some journals will ask for highlights. That is the key messages from your research. Usually it is 5 to 6 bullet points, not exceeding 100 words in each line, and so on. What was already known? What does your study add? Sometimes it could be this context, research and context heading, which the journal wants. And sometimes it may be a graphical abstract. The next 3 slides give examples of these 3. So this is the highlights, key highlights in 4 to 5 bullet points. Next, please. This is the research in context. Ideally, this is very, very short. It can be just 4 or 5 lines. Next, please. And this is a graphical abstract, or what we call nowadays as an infographic, a concise pictorial presentation of the key findings. Next, please. So this is the difference between manuscript and thesis. Basically, manuscript should be short, to the point, concise. It is usually voluntary, but it could be mandatory for professionals, for their promotions, etc. It is usually primary research or review perspective, led by the first author and contribution by all the authors. There are timelines based on the author's preferences, and it is bound by the journal guidelines. But a thesis usually will be bound by the university guidelines. It will usually have a student and the guide and a co-guide probably. And it is always usually primary data collection or primary research. It is important for the doctoral degree. Next, please. Okay. So this is a basic difference. The word limit and length, we have already discussed that a manuscript has to be very, very precise and concise. Thesis can be elaborate. Target audience for a thesis is usually that particular thesis committee or the department, etc., or people from that specialty. A manuscript would be for a greater audience, a larger audience, and it is more structured, has lesser sections as compared to a thesis. But the basic principles of all scientific writing remain the same for a manuscript and a thesis. Next, please. So we talked about for additional information about the ideas being organized, and this is about some additional, we call it bits and pieces. I need a title page, a cover letter, funding if any, conflict of interest, author contributions, certain appendices, or some things which may be a questionnaire or maybe some data sets which may be put in as an appendix. Supplementary files, again, if there are many objectives, those could be taken up. Again, if there are many tables, they can be put as supplementary files, and acknowledgement. Next, please. Okay, so title page will have the title of your study, the authors in terms of addresses, affiliations, and qualifications, the name and email, phone number of the corresponding author, word count, keywords, and short running title. Next, please. Yeah. These are the examples of how a title should be, how the author list should be. Nowadays, they may also ask about author contributions in detail in form of the IJMCE criteria. This has been discussed earlier. Next, please. Again, some journals will ask for a plagiarism check and a certificate that we do not have more than 5 to 10% plagiarism. that is copying directly as per sentences from previous papers. Next, please. Okay. So these are to make your writings clearer, using simple specific words, consistent terminology. I think this has been discussed earlier. Short forms, the first time you use them, you need to expand them, and later on you can use the major topics. Use precise word order, no passive voice, and we need to keep sentences short. Next, please. Okay. Also, before we do the language editing, it should be having a spell check, proper grammar. So we have certain softwares which will check for the grammar check, sentence structure, and punctuation. Next, please. Yeah. So these formatting guidelines again are specifically given by the journals. So we need to check about what is the style, what is the font size, what is the font specific required, what is the spacing, etc. Next, please. So this is the 6S of scientific writing. You should know this for your MCQs. We have discussed all of them. Keep it short, simple, structured, in a sequence. It should have strong information and should be specific. Next, please. So usually what we do is we write a draft, then we share it with our co-authors. It is very important to keep the versions of those drafts, because otherwise I'll end up having 100 drafts with the same name and different dates, and it will be very, very confusing. So always better to have a V1, V2, V3, etc. version 1. So read and revise and then submit once you get the consent from all your co-authors. Next, please. Right. So these are the take-home messages. I won't repeat these. Next, please. Yeah. Thank you. Any questions?
Thank you very much, ma'am, for your valuable contribution.
Thank you.
Any question? Anybody? Okay, thank you, ma'am. I don't think we have any questions in the chat box. Now I would like to welcome Dr. Jayesh Solanki, sir, Assistant Professor, Physiology Department, Government Medical College, Bhavnagar, for making us aware about grant proposal writing. Please welcome, sir.
Audible story. So the last session about grant proposal writing, and the word grant means not just monetary grant, but also about some recognition of your work. So learning objective at the end of this session, you should be able to describe the basic tenets of the grant writing process, features of good grant proposal, and delineate factors that increase the chances of getting funded for your research. So broadly, 5 things: why there is need for grant proposal writing skill, steps in responding to a funding call from funding agency, what are the elements of a good grant proposal, what are the possible funding agencies, and what are the additional tips. So the section 1, need for grant proposal writing skills. So why is this skill needed? Because it is an essential part of your research career. Research depends on the grant money for project, especially if it is large. Say, for example, if you want your article to be published in PubMed Index Journal, if it is funded by NIH, then the value becomes high. It gets easily published in it. Skill for convincing funding agency that your idea are worthy and exciting. So for this, you need this skill. Starting points for a grant proposal: you seek funding for a project which is in hand, and you develop a proposal to respond to a funding call. This is where you begin with. So what is a funding call? Funding agencies ask researchers to submit proposal on a particular topic for a certain amount of money. It is either periodically or ad hoc basis. And synonyms for this is request for proposal, RFP, or call for funding. How to respond to a funding call? So researchers have a generic proposal ready and they keep tracking the calls for funding. The calls usually reach through colleagues or institutions, and guidelines should be thoroughly read. Section 2, what are the steps in responding to a funding call? What if you are called for a funding? So first, seeking funding for a project in hand, you should go like this. Type of project. Based on that, you find the funding agency. You tailor your general proposal to call as per their need. Submit letter of inquiry or full proposal, whatever they seek as information. Agency will review and makes decision. You accept or decline. You complete the formalities and carry out your project. Okay, and at the last, submit the report. For example, if you have done ICMR STS for UG student, the flowchart goes like this only. So types of project. So it depends on, is your research pilot or full-blown research agenda? Full-blown research will get more grant. Thesis or postdoctoral research, there are specific categories for that. Fellowship at institution that will support your work here. Sometimes that adds the weightage. And multi-year clinical project with multiple staff members, that will make it a more case for grant. Refine your topic by asking which topic is more important, which has a chance of being more selected. What is the relevance of this topic to society? What are the possible hypotheses? What are the research methods? Whether it is qualitative, quantitative, or both, or whether it will be observational or interventional. Then you find funding agencies. So prepare list of possible agencies, funding specific to the field, then match the proposal with the priorities set by that agency. It is a time-consuming task because it is not easy in India especially, and in the long run yields great benefits. Finding funding agencies, once again, many sources of information. There may be database available. Then you may go to government institution like ICMR, DST, DBT, CSIR, which give ad hoc funding for projects. Most universities have offices of research and reputable private agencies or NGOs. They may sometimes fund for research. Then you have to tailor your proposal. So when writing, assume that you are addressing knowledgeable academic reviewers, because when they want to give you grant, they will see that your proposal is scientifically sound and novel. Some questions that reviewer usually ask themselves while seeing your proposal is, what is novelty? Is it worth knowing? And how will we know that conclusions are valid? So you have to make these things look like. Next steps, getting your proposal reviewed by colleagues or experts before you submit, then submission to the agency as per the guideline, and just wait for the decision. There may be accepting or rejecting from your side once the result comes. Then there are administrative formalities, because for money purpose you have to give bank details and the mandate forms and all are required. Then in stipulated time, you complete the project. Submit your progress or final report as per the, sometimes they ask periodically reporting also. Then section 3, what are the elements of a strong proposal? So first you develop a general proposal. Most researchers seek funding from several different agencies. So a good idea is to have a general proposal. Your general proposal should explain your project to a general academic audience. Then you organize your proposal. Some standard elements of proposal, they are just like any routine proposal: the cover letter, the title page, then the abstract, introduction, why you are doing the study, review of literature, description of project. But as highlighted, the most important part for which you are getting the grant is budget and why it is required, justification of that budget. Then you can give the timeline and the references for your proposal. more important thing is preparing the budget. It should meet agencies' requirements, tabulate in spreadsheet under different heads, budget heads and categories, add unit cost and number of units and years, because that will give the clear idea about final amount. Add justification for each item. Rules of purchase or recruitment, that should be clearly mentioned, and avoid mathematical errors. So when you prepare the budget, the categories can be like this: recurring cost, staff or personnel, consumable or supplies. Non-recurring, that is forever, that is equipment if you want to purchase, and other like travel or overhead expenses. Now, it should be a task-based budget, and these categories may differ from agency to agency, so you have to see the guideline before making that budget plan. So one of the example, for example, here the head, under which heading you are asking for grant, which item, justification why it is required, number of unit, cost of unit, then quantity and total. This is how it should be given in a proper way. So first is staff, justify in detail why you need it, be explicit about the skill sets, budget only for period required. You cannot extend it beyond. Show people who are on regular pay as zero cost, because they will not be included here. Consider outsourcing or consultancy whenever required. And it is most commonly cut item, because staff we would always have. This is one of the example. You need a scientist, technical assistant. Okay. Then what will be the cost and final budget for this staff heading? Then second thing is equipment, because many a time we are short of equipments. So justify need in detail, be explicit about make and model, because that will be cross-checked. Use available equipment, and so if you already have instrument, then the zero cost will be there. And add the maintenance cost also, because the AMC, CMC will be done, and that should be added in the equipment cost. This example, for example, here they have given equipment like laptop, software, then workstation, furniture. So whatever is required, that you are supposed to give over here. Third thing is consumable or supplies. This should be budgeted generously. It is most likely to be exceeded, because in our studies, we will have staff, we will have equipment, but the consumable we need to use for our project specially. Supplies with expiry dates should be evenly spaced. Examples like printer ink, syringes, vacuum paper, gloves, mask, stationery. So all this comes under consumable. One of the example of this consumable, office essential, what is required, recruitment cost, meetings. So all these are given here as a consumable budget cost. Then other things you may also consider, like travel expense. If you are going for data collection, then consultancy charge, if you are having some specific consultancy, institutional overheads, for example, telephone, electricity, water, vehicle, space, whatever you think that you can add in other costs, miscellaneous costs. For example, here they have given travel, okay, local travel for staff and whatever it is. And yes, overhead at 2% rate, that you can also consider. So this is once again, whatever was there in part, that whole budget is given here under all various headings, and they have given the final cost over here. Okay, this is what you should keep in your mind. Now tying together parts of proposal, establish connection between the various parts, clearly and explicitly state the connection between your objectives, methodologies, and outcomes. Reduce the burden on the reviewers, because all these things should be aligned together, so it will justify your budget also. Fourth section is what are the various available funding agencies. So in India, it is not that many, but yes, we have government agencies like ICMR, Department of Science and Technology, Department of Biotechnology, CSIR, University Grants Commission, UGC, Defense Research and Development Organization, DRDO. So all these are government agencies, plus some private agencies like Lady Tata Memorial Trust, Azim Premji Foundation, and all those things. So that you can find, and then you can seek appropriate grant from them. ICMR grants, yes, because this is initiative ICMR. the level of highest research in India. It gives extramural grants also, and it gives grants for the PG thesis, for your postdoctoral research, international travel, and research workshop. But for that, you have to fill all the mandatory things, and you have to work hard to get that grants. Who can apply for ICMR grants? Yes, regular researcher or scientists in university, medical colleges, PG institutions, recognized laboratories, and NGOs, intended to supplement facility in the host institutions. There are some international agencies also available. For example, this Howard Hughes Medical Institute, all these NIH of USA. So all these you can seek if appropriately suited to your research. Now, database of funding agencies. So where you can find database in India, Research and Development Funding Scheme of central government. So in Indian government site, you may have all these database, Research Development Office, that from where you can find this database. Others like grants.government or Health Researcher Funder .org. So all these things is for database. And last section, additional tips to get the grant. Yes, so you should beware of conflict of interest, because this is what we write in our article as such. But before we write for grant, this should be considered. Disclose financial and non-financial conflict of interest between you and the funder. Vet your funding agencies properly. Be careful of role of funder. Okay. So what increases the chance of success? Read the call thoroughly. What is the prerequisite? Clarify any queries with the funding agency a priori. Strictly follow application guidelines and be realistic in designing the project. This is how you can increase the chance of success. Study successful proposal, that what they have done, you can follow them. Collaborative work, you can use multiple department or multidisciplinary network. As I said, multidisciplinary team. Align with agency's goal, because there are certain agencies, they have given some thrust area of research. So you try to select from that. Establish good track record before going large, because if you have already some grants or some good publication, good Google Scholar profile, then it will be easy for you to take a grant. Developing the proposal, it is also important. Start early and leave time for feedback. Feedback from variety of expert. If required, consult statistician. Explicit connection is required between parts of the proposal. They should be aligned and they should match with the need of funding agency. There should be solid rationale behind the proposal. Highlight that what is a knowledge gap and what is novelty there in your study. Highlight impact of work in terms of societal benefit. Appropriate budget with a strong justification and administrative parts in order. As it said, developing strong proposal takes more time, effort, and experience. So at the last, the take-home message, grant proposal writing is an important skill. Strong proposals require good practice. Do not despair. If rejected, keep trying. Start small, establish track record, align with agencies' priorities, and beware of this conflict of interest. Okay, we all have started something. Okay, and I think DMER is giving the 10 lakh rupees grant. So let us use it. Okay, and with this, I rest. Thank you all for patience listening. Over to Dr. Divyata.
Thank you very much, sir, for sharing your wisdom and expertise. With this, we would like to conclude today's session. Hope this session was helpful. Thank you, everyone.